In youth-serving environments, we invest heavily in evidence-based programs. We teach coping skills, we teach emotional regulation, we teach decision-making and life skills, and many youth complete these programs successfully. A completion does not always translate into lasting outcomes. If you work in residential care, behavioral health, or juvenile programs, this pattern is familiar. Youth engage, they learn the skills, they demonstrate progress, and yet, once structure is removed, many return to old behaviors. This is not because the intervention failed, and it is not because staff failed. It is often because something deeper was never addressed. Self-worth education focuses on the belief systems that sit underneath behavior. It teaches young people how to understand themselves, their value, and their capacity to change. Because belief shapes how skills are used, interpreted, and sustained. Two youth can receive the same intervention. The one who believes change is possible will apply it differently than the one who does not. This approach aligns directly with well-established research and frameworks. Positive youth development shows us that lasting outcomes are built by strengthening identity, agency, and internal assets, not just correcting behavior. Values-based approaches, such as those reflected in acceptance and commitment-informed work, emphasize acting in alignment with personal values rather than fighting thoughts or mistakes. Trauma-informed care reminds us that predictability, safety, and internal control are prerequisites for growth. Self-worth education integrates these principles into something teachable, structured, and developmentally appropriate. When a young person does not believe they're capable, worthy, or allowed to succeed, skills feel temporary, rules feel external, accountability feels threatening, progress feels fragile. But when belief shifts, participation changes, youth begin to see themselves as active contributors in their own growth, not just recipients of treatment. That shift is where outcomes stabilize. For program leaders, this reframes a familiar question. The question is not only, did youth learn the skills? It becomes, do youth believe they are capable of using them? Self-worth education addresses that missing layer. This is the foundation behind the Self-Worth Cultivation Program, a structured, plug-and-play pilot designed specifically for residential environments, where belief-level change must be teachable, safe, and realistic for both youth and staff. When belief is addressed alongside skills, outcomes are no longer left to chance. Self-worth education does not replace treatment. It strengthens what is already in place. Because belief shapes outcomes, and outcomes shape lives.